Ever wondered what causes those stubborn stomach ulcers that seem to recur without any apparent reason? Well, contrary to the common belief, it's not always stress or that spicy curry you had last night. There's a hidden culprit lurking in the depths of many stomachs, causing havoc: the H. pylori bacteria. This tiny spiral-shaped bacterium, residing in the mucus layer that coats our stomach lining, has been linked to several gastrointestinal conditions, most notably stomach ulcers. Despite being discovered over 3 decades ago, many people are still unaware of its existence and its role in causing ulcers. For years, we've been blaming stress, spicy foods, or even our genes. But the reality is, it's often this unassuming bacterium, H. pylori, that's responsible for our stomach woes. It's a silent troublemaker, often causing damage without any immediate signs, making it all the more dangerous and mysterious. Now, you might be asking, what exactly is this H. pylori? Let me introduce you to Helicobacter pylori, or as we like to call it, H. pylori. It's not a new superhero or a character from a sci-fi novel, but a type of bacteria that's as common as the morning coffee. This microscopic organism has made its home in the digestive tract, the winding path that delivers our daily bread or pizza or kale smoothie from the mouth to the stomach. But H. pylori is no friendly tenant. It has a nasty habit of attacking the stomach lining, the protective layer that shields our stomach from the gastric acids that it itself produces. Imagine a shield suddenly turning against a knight in the middle of a battle. Not a pretty sight, right? That's what happens in our stomach when H. pylori decides to attack. Now you might think, oh, I'm healthy, I eat right, exercise regularly, there's no way I have this bacteria. Well, let me tell you a little secret. Approximately 2/3 of the world's population has H. pylori in their bodies. Yes, you heard it right, 2/3. That's more than the population of Europe, Africa, and the Americas combined. But don't panic just yet. Having H. pylori doesn't necessarily mean you'll get sick. Many people carry the bacteria in their bodies but don't get sick from it. The real trouble starts when the bacteria causes an infection or an ulcer. Why some people get sick while others don't is still a mystery that scientists are trying to unravel. It's like a real-life whodunit. But instead of a detective, we have microbiologists, and instead of suspects, we have microorganisms. To sum it up, H. pylori is a tiny bacteria with a big presence. It lives in our digestive tract, often peacefully, but sometimes it turns against us, attacking the stomach lining and causing a whole host of problems. So how does this tiny bacteria cause such a big problem? Stay tuned to find out. Here's where things get interesting. H. pylori is quite the tricky enemy. This cunning bacterium, invisible to the naked eye, has a remarkable ability to alter its environment to ensure its survival. Now, let's delve a little deeper into this fascinating, albeit potentially harmful, biological process. H. pylori, like every other living organism, is designed to survive. To do this, it releases an enzyme, urease, which neutralizes the acidic environment of the stomach. The result? A more hospitable home for these bacteria. Now, while this might sound like a smart survival tactic, it's not so great for the host, that's us. This chemical alteration of our stomach environment can lead to inflammation of the stomach or duodenal lining, commonly known as gastritis and duodenitis respectively. Over time, these conditions can progress to form painful sores or ulcers. And if left unchecked, these ulcers can cause serious damage, even leading to stomach cancer in some cases. Interestingly though, most people with H. pylori don't even realize they have it. It's usually harmless and can live within us for years without causing any symptoms. However, for some, it can wreak havoc, leading to severe abdominal pain, nausea, and other unpleasant symptoms. This is where the real danger lies. For those who are symptomatic, the discomfort can be debilitating. But for the silent majority, the bacteria can quietly cause damage without any obvious signs. This silent attack is what makes H. pylori so dangerous and difficult to detect. Therefore, it's critical to understand that although H. pylori might be out of sight, it should never be out of mind. Regular health checkups and being attentive to changes in your body are essential. After all, your body is your most important asset, and you need to protect it from hidden enemies like H. pylori. But wait, how would you know if H. pylori has decided to wage war within your body? Well, stay tuned as we dive into the symptoms and diagnosis of H. pylori infections in the next scene. H. pylori likes to play hide and seek, often showing no symptoms until it's too late. But when this bacteria decides to make its presence known, the signs are hard to ignore. It's like having a party crasher in your stomach, only this one doesn't know when to leave. One of the most common symptoms is a gnawing or burning pain in the abdomen. This isn't your typical "I ate too much" kind of discomfort. It's more persistent, usually lasting for days or even weeks. Then there's the bloating. Not the kind you get from indulging in a fizzy drink, but a constant feeling of fullness that doesn't seem to go away. It's like there's a balloon in your stomach that someone keeps inflating. And let's not overlook the burping. It's not just a polite "excuse me" burp after a meal, it's more frequent, often accompanied by an unpleasant taste in the mouth. Unexpected weight loss is another sign. And we're not talking about the happy kind of weight loss that comes from a good diet and exercise. It's the kind that happens for no apparent reason, making your clothes feel loose and your energy levels plummet. But here's the good news. This party crasher can be shown the door with a simple test. A blood test can detect antibodies that your body produces to fight H. pylori. A stool test can identify the presence of the bacteria. And then there's the breath test. After swallowing a harmless substance, if your breath sample shows a change, it's a sign that H. pylori is in your stomach. So, you see, this bacteria doesn't have to be a permanent guest. With the right diagnosis, you can begin the process of evicting it from your system. Okay, so we've identified the enemy. Now how do we defeat it? The good news is, H. pylori can be defeated with the right arsenal. When it comes to battling H. pylori, there's a tried and true battle strategy. The most common treatment involves a two-front attack, using a combination of antibiotics to wipe out the bacteria and medications to reduce stomach acid, which makes the environment less hospitable for H. pylori. This 1-2 punch is often referred to as triple or quadruple therapy, and it's been shown to be quite effective. But like any battle, it's crucial to have a solid plan B. If the first line of treatment doesn't work, don't lose hope. There are other antibiotics that can be tried. In some cases, a longer course of treatment may be needed. It's all about finding the right combination that works for your body. But wouldn't it be even better if we could avoid this battle altogether? This is where prevention comes into play. And the key to prevention is good hygiene. Washing your hands thoroughly and often, especially before meals and after using the restroom, can help reduce the risk of H. pylori infection. And let's not forget about food. In some parts of the world, H. pylori is thought to be transmitted through food and water, so making sure you're eating properly cooked food and drinking clean, safe water is another vital step in keeping H. pylori at bay. It's also worth mentioning that regular checkups with your doctor are vital. If you have a history of H. pylori infection or stomach ulcers, regular screenings can help catch any potential problems early. In the end, it's all about being proactive. Whether it's by waging war against H. pylori with a solid treatment plan or by fortifying your defenses with good hygiene and safe eating habits, you have the power to keep H. pylori in check. So, that's the lowdown on H. pylori, but let's quickly recap what we've learned today. H. pylori might be a tiny bacteria, but it sure can cause a mighty problem. As we've explored throughout this video, this little microorganism has a big impact. It's a common bacterium living in the stomachs of about 2/3 of the world's population. Yet, despite its prevalence, many of us are unaware of its existence until it starts causing trouble. When H. pylori goes rogue, it can lead to ulcers and other gastrointestinal issues, with symptoms ranging from discomfort to severe pain. Diagnosis often involves a breath test, blood test, or even a biopsy. Once diagnosed, treatment typically includes a combination of antibiotics and medications to reduce stomach acid. Prevention, as always, starts with good hygiene practices. Washing hands regularly, eating properly cooked food, and drinking safe water can all help reduce the risk of H. pylori infection. Remember, knowledge is power. The more you know about H. pylori, the better equipped you are to prevent or deal with it. Stay healthy, and thank you for watching.